What are the 4 jaw-dropping beauty treatments you want to do for 2024? Stay tuned because we're going to tell you. Hey, Doc audience. Rod, we've got 4 jaw-dropping beauty treatments people are going to want to do for 2024. So lead it off. Tell us about these things.
Okay, jaw-dropping. Is it?
Jaw-dropping.
Well, the first one is
jawline fillers.
The jawline fillers, okay? And when you follow this, it's starting from the back. It's the masseter. It's the strongest muscle in the human body, believe it or not. Per capita, I mean, it's the strongest muscle. So if you put Botox in there, you can soften and weaken it, then you can get better shaping. And then if you go further forward, you can put a filler in there. You can put your own fat. You can put on calcium hydroxyapatite. It's like sea coral. You can put that in there. Jawline filling.
So you can, I have a big masseter. You can,
yeah.
Right here, so I could use a little Botox there to, Rod, maybe you have to do that, like just to contour that, to give me a little nicer,
a more elegant
jawline.
look.
But yeah, and that's actually become very popular. Masseter, just to soften that. In people's jaws.
Not only does it look better, but people use it for, if they have bruxism, TMJ pain, even TMJ-induced migraines. So it's more than just an aesthetic improvement. It really works incredibly well.
Yeah, that's cool stuff. All right, so number 2 is the so-called biostimulator. So tell us about what that is.
Well, I think the other thing is we are so filled up with fillers. There's a lot of things about fillers that are good, but one of the things that people need to know is that even the biodegradable fillers don't all go away, the hyaluronic acid fillers. And I know we've talked about that before. These are a separate class. And biostimulator, you're stimulating the body to produce its own collagen, which makes sense. There's some incredible ones. There's Sculptra, which is really like a biodegradable suture. And by an inflammatory response, it stimulates collagen. And that works well for, especially if you have central facial fat loss, but it's stage treatment, 6 to 8 weeks apart, multiple treatments, and it lasts up to 2 years. And then there's Radiesse, which is also a biostimulator. It's calcium hydroxyapatite, and this directly stimulates collagen without an inflammatory response, and it works.
Yeah, that's it's interesting because it's a totally different. The fillers like hyaluronic acids would certainly have their place, but you're just adding a product and it's going to stay there for a while and then it goes away. Whereas this is actually, like you say, collagen. When we say stimulates collagen's the good thing, right? That's what you want. And
I think the whole body of stimulus with biostimulators is huge, and I think it's very safe too. Obviously done by someone that really is an experienced injector.
Yeah. All right, well, number 3 is something that you're very familiar with, being a facial rejuvenation expert, but minimally invasive neck lifts. You've done neck lifts for many years, but this is less invasive. So what options do people have?
So the minimally invasive one is ones where you use radio frequency microneedling like Morpheus. And then if you have more laxity, you can add something called Face Tight, which is also a radio frequency skin tightening. It breaks up the deep fibrous tissue, it stimulates collagen, and also it breaks down fat. If they don't have jowls and you have neck laxity, you can, with a little incision here, do Face Tight and liposuction and tighten the muscles without any other incisions. But those are selective patients, but it works well. That's why you need to go to an expert. Like you said, a board-certified plastic surgeon or facial plastic surgeon that really does this a lot. And it's not for everybody.
All right. Well, number 4 is they're called a subdermal hydrator, SKINVIVE, right?
Yes, SKINVIVE is the first skin booster that's now available in the United States. And basically, you can just with it's like a little bee sting, Bill. You just inject it in your cheek, and really it kind of moisturizes and pumps up your skin in the dermal level. It's really this new class. You're going from biostimulators to skin boosters. So we've gone really deep. Now we're kind of working on the superficial layers.
When would you recommend your patient to do a SKINVIVE treatment?
If they feel like they're, not only is their skin drier, but also if they just look like they've lost some fat in their face, this boosts it up fairly rapidly, and it lasts for months. So I think it's a good thing in a younger age group, 30, 35, and it acts at the skin level.
Yeah. All right, that's great. Full throttle information. But if you like this, you're going to really like this video on Kylie Jenner, the Kylie Jenner effect on cosmetic surgery procedures.